Hey out there, still on the topic, improving reproductive health strategies for optimal fertility. I'm still your favorite host, Uchenna Amadi, and with the remarkable Dr. Ogunniran and Dr. Igbodike, who are consultant gynecologists. A lot has been said since the beginning, and we have touched on understanding reproductive health and fertility, the factors that affect it, and the medical interventions as well. Be sure to go back to the previous episodes and listen if you have not. In this episode, we shall be bringing you expert insights and practical tips on how to manage a couple going through fertility care. Please do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and Spotify. Okay, Dr. Ogunniran, I'm curious to know, because a lot of people talk about IVF and, that kind of thing. So can you briefly explain to us how it works?
All right.
IVF and is it IUI?
Okay, all right. So there are various fertility treatment options when it comes to problems related with infertility. All right. So IVF simply means in vitro fertilization. I will break that down. What it just means is fertilization outside the body. Okay. And what is fertilization? When an egg is injected with a sperm, all right? Or normally in the body system, we expect that for women that are ovulating normally and the sperms are fine, the sperms during sexual intercourse should swim all the way, meet to the egg in the tube. And once it gets fertilized, it moves back to go back into the womb to get implanted before it can start talking about a pregnancy. Okay. But now, if that doesn't happen naturally, all right, there are various fertility options that are available. For example, a woman that has her tubes blocked, it means there's no way sperm and egg can meet. Yes. All right. A woman that is also not ovulating regularly. The fact that she's not ovulating regularly means there's no way sperm and egg can meet. Or a woman that has low sperm count, all right, or low sperm movements, or the abnormal forms are so high in the body system, or it doesn't have sperms at all. It means fertility treatments that are extensive needs to be done. And one of those options is IVF. All right. Okay. So IVF simply means that you have to take control of the cycle of the woman. There are some injections that usually we prescribe for them to take. All right. And we go and collect the eggs. All right. The eggs are collected, and the sperm for the man is also now used to inject or inseminate those eggs. Okay. The embryos that will now generate is what will now put back into the woman, right, to try and achieve a pregnancy. Okay. All right. The first baby, Louis Brown, is over 40 years old now. That was born in the UK, and that has been the first IVF cycle, first successful IVF cycle. Wow. After then, millions of babies, all right, have been born through this process. Wow. So usually when we advise couples that, look, you need to go through this thing, they ask questions like, it seems unnatural. Yes. Is he a normal child? Is it a normal baby? I will tell them, no, they are normal babies. It's just that we're doing the generation of the embryos outside the body. We monitor them for some days in an incubator that resembles the natural womb of the woman, and of course this enables that embryo to continue to grow, and at a point we just pick those embryos, then transfer them back into the womb of the woman to try and achieve a pregnancy. Now that is different from the IUI, where some people know it naturally as artificial insemination. And what that means is that we're just pushing semen, all right, into the womb of the woman and still waiting for fertilization to take place. Now, of course, we know that this has a lot of probabilities, because that means that the woman must be ovulating, the tubes must be open, the sperms must be fine, and the womb also must be a natural fertile ground that will allow, do you understand, the embryo that has been formed to now implant. And of course, there are different indications, all right, for even an IUI cycle. So, for example, we know that career-wise, a lot of people are staying apart, all right. So for about 5 years personally, I was not living with my family. All right, I had to travel every 2 weeks or 3 weeks, but at least thank God mine was very good, because all those times I was coming home and I was just shooting the correct thing. She was getting pregnant. All right, but some people have that challenge. It's not happening because they are staying apart. So, but all the parameters are fine. But because they're not having regular sexual intercourse, as Dr. Igbodike has said, pregnancy would not take place. So for such people, we could advise them, if all the parameters are fine, to consider IUI, which is artificial insemination. So the woman just takes 1 or 2 medications. We see that at most 2 follicles are growing, and we just inseminate the sperm after the woman takes some injections. But for IVF, it's more extensive. They've identified issues. Tuber problems are there. Low sperm count is there. The womb has some challenges, or the woman is not ovulating, or she's getting, her reserve is also reducing. Because I remember I talked about the age calendar as well. As the woman is increasing in age, her eggs are reducing. The quality of the eggs are also reducing. And an option that I think I wanted to add to what Dr. Igbodike said earlier, some women are also single for many years. A male partner is not coming, or they keep having these heartbreaks. But your own age calendar is increasing. Why not come and freeze your eggs? All right, it's a form of preventive method. So you can come in years later and decide, oh, now I don't even have a partner 45. Can I use donor sperm to inject these eggs and I carry my baby? All right, but your eggs are better quality because you froze them many, many years ago. And of course, this has helped a lot of women as well on the career pathway. I must be a professor before I get married, or there's no man coming in line. So these are various options that are available. For some women that are even above 40 years, all right, where we've checked their hormones, their reserve is very, very low, we can offer them donor eggs as well. All right. So these are all intricate aspects of IVF. And one other interesting aspect is we know that before, in time past, when you're AS, they say, I don't marry because you have an SS child. All right. But that has changed now.
Wow.
All right. Because there's an extra aspect that comes with IVF, what we call genetic testing. So you're able to generate embryos after you've gotten the eggs and injected with sperm, and able to analyze these embryos to determine, is this SS?
Wow.
Is this AA? Is this AS? Before you now transfer the embryos.
That's impressive.
There was one couple that I managed. They were both AS and they had an SS child, all right? And they wanted to go, of course, they wanted to have another baby. They had to go through this process. But one fortunate aspect is there's something we call in medical practice HLA typing. So they help us to know that this embryo that was generated, can it be a source of bone marrow transplant to this unhealthy child that has SS, all right? So trying to help that baby. All right. So when we transfer the embryos, fortunately, the one that had the exact match was the one they gave birth to. All right. And that is the person that wants to now do bone marrow transplant for the child that is a sickler already. So this it has changed and revolutionized even reproductive health and fertility practice to help a lot of couples all around the world.
Wow. Thank you very much. Dr. Igbodike, do you want to add anything?
So I want to say something concerning, when we talk about tubal factor infertility, it accounts for almost 60 to 70%, depending on literature you're looking at in terms of what causes infertility. Now, for women that have bilateral tubal blockade, it's a ticket straight to IVF. Some we have unilateral, and they may want to try IUI, which may work. So if the one that is open becomes the lucky one, that can, so we're looking at options here. And again, we'll talk about artificial reproductive techniques and the assisted conception. In ART, that is artificial reproductive, we are handling two gametes. The semen and eggs. Of course the eggs. But in IUI, it's not ART because it's only one, which is just the semen. So it can be under assisted conception. So these are some terminologies you hear people use, and we should know the difference.
Okay, thank you very much. Yeah. So speaking on comprehensive fertility care plan for couples, Dr. Ogunniran, how do you create that?
Yeah, so when they come into the system, when we've evaluated them, all right, we're able to say this is what the problem is.
Yes.
What exactly do we do for you? All right. So somebody will say, my sister said I should come. They did this for her. I want the same done for me. You are not the same, even if you are twins. So it's just focused treatment, all right?
Yeah.
And we manage couples as individuals, all right? To just manage them as and giving a holistic approach to their case. So comprehensive just means that we're doing something that is specific for you. What exactly works for you may not be the thing that will work for another person.
Of course.
If I've recommended this for you, this might not be what is happening for you. So it's just having a focused plan to manage couples when they come into the system.
Okay. So Dr. Igbodike, I want to ask, what strategies can help couples cope with emotional and psychological aspects of fertility treatments?
Yes.
What can we do to help?
This is a very important, question. Because in this part of the world, we don't really necessarily pay attention to the psychological issues. Yeah. Everything is, I'm sorry to say this, but see that somebody's praying and all the prayers are very good. But we're talking about the mind, Somebody that's already thinking about IVF, majority, they are not very happy.
Yes.
How do you manage this? There should be a segment whereby the mental health physician has to come in. They need to listen to these people. They need to know, listen to them, let them ventilate, and of course, they will now be cancelled of the fertility option and be guided along. Then I will not remove the issue of family. Support system.
Yes, I was going to ask.
Some couple, oh God, their mother-in-laws are not helping matters. Anytime you see the lady, you want to remind her, okay, are you pregnant now? Please don't ask these questions until it's about 1 year. okay, of marriage, or 6 months depending. And when you must ask it, there must be a tone. You mustn't bring it to the face of the woman. Allow them to go through the process, because sometimes there's a lot of pressure from the family, especially either the girl or the man. It depends on the two. So they need all the support system, okay? And also they must be guided on meeting the ideal specialist, because some people will first of all take Abo, then from Abo they will go to the native doctors. From there, then they will go for special prayers for 7 years. By the time they are coming to the gynecology, they're already 42. So their chances are limited. So early presentation to the hospital will help in terms of in their psychological management, getting results, and of course, bringing a happy mother to a satisfied mother, and of course a happy family. So that's what I'm going to say.
So counseling,
speak to the supporting.
The support system is very, very important. They are coming from a place of pain.
Yes.
They are coming from a place of stigma. A lot of people in this part of the world as well are not bold to say, yes, I had fertility treatments. Or rather, it's good. As I said, prayers are good. They give testimonies. But the fact that God has even given the knowledge for us to even use for fertility treatment is even like a milestone itself. So counseling and empathy is very, very important. And that's why it's also a goal for every couple to have counseling. All right. It's the mental health. It's very, very important. By the time you're also depressed, all right, infertility is a major cause of depression. It might not even show on the face. People that commit suicide, they won't show on the face. They look very happy. All right, but they are depressed. All right, so because depression also is a major factor, so they need to go through a lot of counseling, and that support system is important. You mentioned about the mother-in-law. Even there are some father-in-laws too. They'll be like, honestly, when are you giving me my prince? Really? When am I getting my grandkid?
I thought the fathers are the chill ones.
No, it's happening now. It's happening now. So I think the family support system is also very important. And when you are really supportive, it's not just for the family, even for the partners. So we see some people that it's just the woman coming in. In fact, what we do in a place I work, we just say, when you're coming in, we are doing scans, your husband must be there. So it's not, in fact, some men are the ones that give the injections. It creates that bonding system. So the support system is there. And we encourage that a lot. And some people, you see them, they're the ones rubbing the back. We're doing their procedures. They are in there. So they know that, look, this woman is a diamond. I must treasure her all the days of my life. You understand? So that support system is very important. There are also peer support groups that are available. There are people that have these different groups and platforms where they talk about fertility challenges, and they're able to get advice, because as I said, people go all around. There was a woman we managed at the time that had fibroids, and we told her, you need surgery. I said, no. There's something she's going to take one agbo. Now she inserted the agbo, unfortunately, and that even just it created it burnt the whole of the vagina, and we had to create a new vagina itself entirely. And so you had the problem, you added to your problems. All right, so it's important to go to the right support, have a right support system, go to the right place, have a specialist see you and be able to tell you that this is what you need. And yes, your faith also works for you at the end of the day. Absolutely. So I giving you something, you're also adding your faith to it. At the end of the day, yes, a happy couple and with happy babies, and everybody gets happy.
So thank you for touching on the partners, because I was going to ask you how you involve both partners in the treatment process to ensure that both of them are equally supported.
Very important. Very important.
So do you want to elaborate on that more?
So
because
also when they come in, the first time they come in is at the consultation.
Yes.
Most of the time we say both of you should come together. When you are doing the review of the results, both of you are there. So at that point you are not saying, they say your sperm is bad and making him feel less of a man because he doesn't have sperms. All right. So it's important that we also counsel them, and they are both actively involved in that process. So I mentioned earlier that they are doing tests. They are also both doing tests. So when we come, doctor, just do my test. I know I'm the problem. Why do you think you're the problem? Why are you not here with your partner? Your partner must be here.
Yes.
All right. And by the time we assess them, you now discover that it's the man that is the problem. Do you understand? And of course, what happens? The man now becomes gentle. Like, hey, problem has started. And he's focused on himself. So, but we don't just focus on an individual. It's both of them to just ensure. By the time they're even signing consent form for the process, both of them. So you know that this journey is from beginning to the end.
Yes.
All right. So that support system is just so important. Of course, we counsel them on and off, often and often, to just make sure that they fully understand that this is what the challenge is and what they have to go through.
Thank you so much. I'm wondering if you wanted to add something.
I want to say something about some of the difficulty or limitation of physicians. This counseling session is important, but we must also know that in law, both the woman and the husband, they are seen as individuals. So sometimes you need the consent of the man to discuss the problems of the woman and vice versa.
Wow.
So if the man has 0 sperm, you need the consent to discuss that with the wife. So you cannot just go ahead and tell the wife, your husband. You can dissolve a family within you just in seconds by saying that. So doctors are under, under oath, and of course they are also obeying ethics of trying to gain consent of both before you can discuss that. And let me just say, we are not discarding prayers, but don't forget that prayers without work is useless.
Yes.
So as you are praying,
faith
you should be walking. Faith, exactly. So you should add two together. So as you are praying, please do that early. You are doing something with your fertility doctor, your gynecologist, while you are doing the prayers.
Thank you very much. This has been quite insightful. Thank you so much, doctors, for using your expertise to, elaborate on this issue. And that, dear listeners, brings us to a wrap on another exciting journey on the SYNLAB podcast. We hope that you have gained valuable insights. If you gained from this podcast, please share with friends and family. And before we go, a heartfelt thank you to the amazing Dr. Ogunniran and Dr. Igbodike for gracing us with their presence. And in keeping with our tradition, I would like you to please sign on our legacy board.
Right, that's great.
This is what we normally do to say thank you for gracing us with your presence. Thank you all for joining us. And remember, small steps can make a big difference in your journey. Stay proactive, and here's to a healthier future. Do not forget to like, subscribe, share, and follow SYNLAB Nigeria on YouTube and on Spotify. You can also follow SYNLAB Nigeria across all social media platforms. My name is Uchenna Amadi, and I'm signing out.